I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press bell icon button. Today I'm going to talk about pink eye or red eye or conjunctivitis. Pink eye or conjunctivitis is an inflammation or infection of the transparent membrane, which is also called as conjunctiva or sclera, that lines your eyelids and cover the white part of your eyeball. Viruses, bacteria, fungi, or any pollens or dust can cause conjunctivitis. So what are the common signs and symptoms of conjunctivitis? Redness in one or both eyes, itchiness in one or both eyes, a gritty feeling in one or both eyes, a discharge in one or both eyes that forms a crust during the night and may prevent eye or eyes from opening in the morning, tearing. Several viruses can cause viral conjunctivitis, with adenovirus being one of the most common causes. Other viruses include rubella virus, measles virus, herpes viruses, for example, herpes simplex virus, varicella zoster virus, which also causes chickenpox, shingles, Epstein-Barr viruses, picornavirus such as Coxsackie A24 and enterovirus 70. Viral conjunctivitis is highly contagious. Usually viruses spread from one person to the other person, from hands to eye contact, by hands or objects that are contaminated with the infectious virus. Depending on the cause of viral conjunctivitis, some patient may have additional signs and symptoms, for example, common cold such as flu or other respiratory tract infection. Pharyngoconjunctival fever is also very common. In this syndrome, person also suffers with sore throat and fever. There is another form of viral conjunctivitis which is called as epidemic keratoconjunctivitis. It is a more severe type of conjunctivitis commonly caused by the adenovirus types 8, 19 and 37. Acute hemorrhagic conjunctivitis. This is a type of conjunctivitis that is often associated with epidemics worldwide in tropical areas and subtropical areas. Enterovirus 70 or Coxsackie A virus cause acute hemorrhagic conjunctivitis. There is another form of herpetic keratoconjunctivitis which is caused by herpes simplex virus. Now let's talk about bacterial conjunctivitis. Bacterial conjunctivitis is caused by Staphylococcus aureus, Haemophilus influenzae, Streptococcus pneumoniae, Moraxella catarrhalis. Again, bacteria spread from person to person, from hands to eye contact or via eye contact with contaminated objects. Bacteria can also spread by large respiratory droplets. Topical antimicrobial therapy is indicated for bacterial conjunctivitis. Some patients also suffer with hyperacute bacterial conjunctivitis. It is a more severe type of conjunctivitis that develops rapidly and can lead to corneal ulceration. It is accompanied by eyelid swelling, pain, decreased visions. Neisseria gonorrhea is one of the important cause of hyperacute bacterial conjunctivitis in sexually active adults. In some cases, it may lead to vision loss. Another form of bacterial conjunctivitis is chronic bacterial conjunctivitis. It is defined as if the symptoms last for at least for 4 weeks. Often happens along with blepharitis, that is inflammation of the eyelids, debris and warmth along the lid. People with this condition should see an eye doctor. Chlamydial conjunctivitis is also very important cause of conjunctivitis. In neonates, if the baby born to a mother with chlamydia trachomatis can acquire chlamydia during the birth from birth canal, it is called as, if it occurs, it usually occurs within the first 4 weeks of life, and it is called as ophthalmia neonatum. Usually symptoms develop between 5 to 12 days after the birth. Neonates with chlamydia infection, they can also develop infection in lungs, nasopharynx. So the parents should take their baby to doctor for urgent medical help. If anyone is sexually active, they can also suffer with chlamydia trachomatis infection. There is another form of conjunctivitis or eye infection that is called as trachoma. Trachoma is one of the important cause of blindness, which is definitely preventable. Let's talk about gonococcal conjunctivitis. It is a common cause of hyperacute conjunctivitis in neonates and sexually active adults. The signs and symptoms include red eyes, thick pus in both eyes, swelling of the eyelids. So babies usually develop first 5 days of life this infection, and they require urgent treatment because they could suffer with meningitis. Gonococcus or Neisseria gonorrhea can cause systemic illness in adults, including joint infections, bone infections. So there is another cause of conjunctivitis that is called as allergic conjunctivitis. If someone is allergic to pollens from trees, plants, grasses, weeds, dust mites, animal dander, molds, or cosmetics, so they also develop conjunctivitis and their eyes become red. So the diagnosis is always based on the history as well as signs and symptoms of infection. So in most cases, doctor check patient and can diagnose on the basis of pink eye, asking different questions about your general health. If needed, then samples will be done and sent to microbiology, for example, pus or eye swab, whether it is caused by any bacteria or virus. So treatment is always based on the causative agent. If antivirals are indicated, so antivirals will be prescribed. If bacteria is causing conjunctivitis, then antibiotics will be prescribed. And preventive measures, how to prevent conjunctivitis, is very important. So do not touch your eyes with your hands. Wash your hands quite often. Use a clean towel and wash cloth daily. Do not share towels or wash clothes with your other family members or your mates. Change your pillowcases often. Throw away your eye cosmetics such as mascara. Do not share eye cosmetics or personal eye care items with any of your family member or your friends. Thank you very much for watching this video. If you have any question, please write down in the comment section and I will answer your queries.